We are transmitting live from San Diego, California, from the studios of KPBS on the campus of San Diego State University. Greetings to our participants in Mexico, Panama, Costa Rica, Colombia, Paraguay, Brazil, Bolivia, Argentina, and other countries in Latin America. We would also like to welcome our distinguished viewers here in the United States. And we would like to thank again Telecomunicaciones de Mexico, PanamSat, and BrazilSat for their satellite linkage services, which allow us to reach all of you through the wonders of telecommunications. Welcome to the program Human Resources and Health, Integrated Strategies to Improve Productivity, the fourth and last video conference in our 1995 Strategic Resource Management series. My name is Frank Medeiros, and I will be your moderator for this video conference. As this is the last program in the series, we would like to remind the coordinators at each receive site to collect the attendance sheets for your site and to return them to the International Training Center within 2 weeks. At this time, you should also return to us a list of names of participants interested in obtaining the certificate or diploma for this series of programs. This program is composed of 2 presentation modules and 2 question and answer sessions. We look forward to your live participation. Today's program is important given today's global realities. As the dynamic nature and pace of globalization continues, businesses, government, and educational institutions will more than ever be challenged to manage their human resources. Integrating management strategies, which include the health of a workforce, is essential, as clear correlations can be drawn to productivity. Productivity, as we near the 21st century, equates to competitiveness, growth, and organizational survival. World-class performance can only be achieved if the mental, physical, organizational, environmental, and social aspects of a workforce's health and well-being are strategically managed. This video conference will discuss the roles that should be played by governments, private businesses, educational institutions, and the medical community in order to maximize health and productivity. Additional views of on-the-job concerns, such as ergonomics and the recognition of the challenges of managing the health of a workforce in an expanding service sector environment, will be highlighted. Off-the-job issues, which impact the health and welfare of workers, such as housing, transportation, and education, will also be presented, as these have been receiving significant consideration in the United States as well as other parts of the world. Within the realm of managing the health of a workforce is the recognition, evaluation, and control of stress. Considerable research has been conducted which is indicative of the need to reduce stress and to control the factors, whether on or off the job, which create stress in one's life. It is my pleasure to present to you today's guests and distinguished speakers, Mr. Daniel Hopwood and Mr. Kim Fuller. Mr. Hopwood holds a B.S. in Health Sciences and a Master of Public Health, both from San Diego State University. He has practiced and consulted in the field of occupational health and safety for over 16 years, with an emphasis on creating winning strategies to control occupational injuries and illnesses. He has written and published extensively on wide-ranging topics. The focus of much of these combined efforts has been to improve productivity. He was a past chairman of the Surveillance Subcommittee of the American National Standard Institute's Committee on the Control of Work-Related Cumulative Trauma Disorders. Mr. Hopwood has served as the president and chairman of the board of the San Diego Safety Council, and in 1995 was named the first champion of safety for his work in the organizational, scholastic, and environmental sectors. Dr. Fuller is the director of the Department of Occupational Medicine, a part of the Sharp Reese Daly Medical Group, and Sharp Healthcare, a vertically integrated healthcare system with 7 hospitals and multiple clinics throughout San Diego County. His department currently takes care of approximately 6,000 industries in San Diego County, from small companies having few people to the thousands of City of San Diego employees. Dr. Fuller holds a Juris Doctor degree from the University of Illinois and served as an attorney for the U.S. Energy Research and Development Administration in Washington, D.C. from 1976 to 1977. He later pursued a medical degree at the University of Illinois, receiving his MD in 1979. He is the chairman of the Occupational Medicine section of the American Practice Association and has published and lectured extensively on the topic of occupational medicine in group practices. Welcome to you both, gentlemen. Before we begin, I would like to ask both of you the following question, and that is, why will managers in the future be required to understand in much greater depth the issues and strategies related to the overall health of their workforce?
Very simply, it is now well accepted that good medicine is good business, and that the healthy worker will be more productive than the unhealthy worker. As any economy develops, this will become more and more important.
Excuse me, I couldn't agree more. Part of what I think we will discuss as our presentation goes along today is the fact that much of the responsibility for organizations and employers is the recognition of the factors that impact health, and the fact that in a changing world and global dynamics, these changes are coming much, much quicker, and part of our strategy should be to accommodate that speed of change.
Thank you very much, gentlemen. It seems that today's presentation will be quite motivating. Let us begin with Module 1, where Mr. Hopwood will discuss the integrated approach to enhance productivity through improving the health of a workforce.
The world in which we live is changing. Nations which are considered developed, as well as those with developing economies, are facing an ever-increasing pace of change, and the change is coming locally, regionally, and globally. The changes we are all faced with come from the flow of information, technical developments, and the continued melding of national and working cultures, as well as the ever-increasing transnational economies. To not only survive the changes we will be faced with, and to manage them effectively, management teams from governments, educational institutions, as well as all facets of business must first recognize the changes, and secondly, develop strategies to manage them. In many cases, that means making the changes work for you, not against you. There is one consistent link in these changes, and that is the human resources within every organization. The health of our human resources will be the single most important asset to manage in the years to come. To effectively meet the challenges which lie ahead, we must work to maintain the health of our human resources and, in fact, work toward improving their health, both while at work and in non-working activities. There are many correlations to worker productivities and their health. Bernardino Ramazzini, the father of occupational medicine, said, "It is poor profit which is achieved by the destruction of health." Although Ramazzini said this in 1700, it is equally true today. In fact, with workforces becoming increasingly specialized, maintaining the health of human resources may be even more important. In many cases, maintaining their health may be more difficult, requiring significant commitment by employers. The flip side to this commitment is the retention of satisfied, productive employees. During the second module of this program, my colleague, Dr. Kim Fuller, will share with you some essential thoughts on the role of healthcare in industry, using the field of occupational medicine as a model to highlight advantages for employers and their human resources as well. Today, we will talk about the need to improve the health of human resources and to integrate strategies which enhance productivity. The inclusion of productivity as an outcome of implemented strategies is essential. As we move toward the 21st century, productivity will equate to competitiveness, growth, and in many cases, organizational survival. The employment patterns and projections for the next few years have been hypothesized by many. The United States represents a good global model of what will be seen more frequently in the organizations around the world in the future. Aspects of this global working model to consider, which will have an impact on production, are the technical skills of the human resources, the aging of the working population, and a shifting of the productive base to include more working women, as well as a continuing shift to a service economy. Each of these likely changes brings new opportunities for economic growth, but also poses its own set of safety and health concerns. For example, an aging workforce, which is stable and reliable, should provide improved productivity. Without careful management, they may be exposed to higher degrees of risk for cumulative trauma disorders, if for no other reason the amount of time they have been working at specific jobs. Any injuries and illnesses which develop will have a direct impact on productivity gains. In the United States, it is estimated that 51% of the workforce will be between the ages of 35 and 54 by the year 2000. Inasmuch as this group represents a good portion of the United States baby boomer culture, there is a high degree of education, perhaps the highest level in the U.S.'s history. Many have found a correlation between education and industrial successes. David Halberstam, in his book, The Next Century, notes that there is a correlation between Japan's and Korea's primacy in education and their industrial successes, as well as the correlation between the test scores and the lack of productivity and economic health. It is clear that to maintain these industrial strengths, a nation or an economy must work to maintain the health and safety of its human resources. You will find over the next decade that available working populations which are capable of improving your productivity will diminish. Therefore, maintaining the health of existing workers is essential. The message of this video conference bridges all facets of listeners. Educators and educational institutions must pass along the vital need to understand the link between health and productivity and to continue the study of this link. Governments will have increasing responsibilities to nurture environments where continued education and research can take place, such as with the provision of grants and partnering with private industry where feasible. Business organizations will be responsible for assisting their workforces in maintaining health and understanding the need to be healthy. This responsibility will grow in time as many nations' workers will have increasing difficulties with the access to health care. The employer will be the focal point for many elements of health care in the future. I'd like to now share some thoughts on health and productivity. The advantages of maintaining health within a workforce are in most cases to reduce operational inefficiencies. The inefficiencies of a less than healthy workforce are many, but are concentrated in increased turnover, production requirements not being met, quality problems, and a loss of competitive position. Health for many has two meanings, one of which is a current state of physical well-being, while the other concentrates more on desired state. That is, most of us have a clear view of our present health, and in fact, most of us have desires to change our health condition for one reason or another. This analogy can be made on the organizational scale as well as that for the individual. The quality of work life for any group of human resources is clearly within the sphere of influence of an employer to manage. Managing the day-to-day work stresses and anxieties will show continued returns. These positive returns come not only in the form of improved worker health and productivity, but also in the form of improved relations between workers and employers. It makes sense that as employers, business leaders, educators, and policymakers, that we work toward enhancing the health and safety of those that work for and with us. By doing so, traditional measures of productivity are enhanced. For example, to reach maximum potential output, organizations and larger-scale economies must employ as fully as possible their labor and capital resources. To reach maximum output, all human resources must be as physically and mentally ready to work as possible. The improvement of health and productivity will not come without focus and planning. As many of us have been involved in the past, strategic measures are in order, for without sound strategies, our efforts will be less than desired. Without strategies, any improvement which is attained is likely to fall victim to the Hawthorne effect and be short-lived. For example, it is equally important to have production capability improve via enhanced health as it is based on social dynamics. Recognition and control of physical and process hazards is a major tenet of managing worker safety and health. Coupled with improvements in the social realm, however, production has the opportunity to improve dramatically. One necessary trait of our efforts to improve health and productivity must be the flexibility to recognize continuing changes in our human resources and the factors which create hindrances to productivity. By recognizing these changes, whether they be social or technical, we create management strategies which evolve along with them. Without this tactical evolution, we will once again find our strategies and plans for improvement being questioned, attacked, and in many cases, failing to accomplish goals. What sorts of social and technical matters come to the fore, especially when we refer to recognizing the issues which impact the health and safety of our human resources? These run the gamut, but include wages, productivity, that is to say, production demands, work organization, which includes worker influence and control, automation, other technological changes without human resource input, and finally, stress and other ergonomic stressors of work. An important distinction to make is that when we say health, we are referring to the health and safety of workers. Acute and chronic health concerns exist, and they both are essential to control. It is also necessary to recognize that acute and chronic stressors are changing dramatically. The way employees accomplish tasks are changing at the same lightning speed. Developing and developed economies alike need to increase their skills in recognizing the conditions of change, three of which I have already alluded to. Those are the speed of information, technological advancements, and cultural blending. In the book, Technological Change in the Workplace, Health Impacts for Workers, published by the University of California at Los Angeles, details not only how technological change comes about, but as well highlights the health outcomes for workers, or as we have been referring to them, human resources. These outcomes include both positive and negative results. For example, many technological advances reduce the exposure to harmful activities, such as lifting heavy items. These same technological changes can also result in reduced employment, which is not a goal of developing nations and their economies. In some cases, technological advancements may actually increase employment, but without controls, injuries and illnesses may also increase. One case study reviewed detailed the transfer of vehicle manufacturing equipment that had been originally designed for use by U.S. men to a maquiladora or assembly plant in Mexico. The users of this equipment at the maquiladora were predominantly women. The outcome of this transition was a great number of cumulative trauma disorders, primarily due to size differences. To alleviate this problem, significant changes had to be made to the equipment. Could the outcomes of this technological change or introduction to a work unit have been anticipated? The answer is yes. Changes which will be facing workers and employers alike fall into several realms. These realms include the following: the physical realm, mental, organizational, environmental, and the social realm. By integrating strategies to improve one element of a worker's life, others will be positively impacted. For example, if physical surroundings are improved, or if the physical hazards present in a work area are mitigated, the mental aspect of worker performance will be improved through a reduction in mental stress. I'd like to review several specific issues now which human resources face and emanate from several fronts. These include on-the-job dynamics such as hazard recognition and control, off-the-job considerations which impact health, the role of education, both internal and external to an organization, the management of stress, or more importantly, the management of the risk factors which result in stress-related reactions, including the impact on productivity, and societal issues at large, most of which impact the lives of workers and thus their productive capabilities. Let's briefly discuss each area. In addition to the informational and technological changes which continue to develop, human resources must be knowledgeable of the importance of taking, along with their employers, a preventive approach to achieving good health and must make themselves accessible to health care. That is, when health care has been made available, it should be taken advantage of. The health care which is provided may need to take alternate forms. For example, many U.S. businesses and insurance companies have found that making chiropractic care available has kept some employees happy and has objectively contributed to their health. The use of such non-traditional models of health care provision is just as important in the treatment of workplace injuries and illnesses. Other alternate forms of health care which need exploration at the organizational level include holistic and self-help forms. Keep in mind that neither of these models suggest self-diagnosis, but refer more specifically to the actions taken once an injury or illness has manifested. Employers and governments will be making vast contributions to their productivity measures if they work toward expanding the network of available health care facilities and options. For some countries and economies, this may mean supporting the development of health care outside the workplace and expanding its availability. Organizational benefits to improved health includes a reduction in turnover and better morale, both of which are positively correlated to productivity. The human resources themselves must be cognizant of health hazards outside the workplace, which impact their ability to be as productive as possible. It will be in the best interest of employers and governments alike to establish programs to benefit their human resources, such as wellness programs. Many large, medium, and small organizations in the United States have made the investments in wellness programs and have reaped the benefits of happier, healthier, and more productive employees. For example, Xerox has established health management programs to include cardiovascular fitness through exercises and sports. They have also published a book for their workers entitled Fitbook, which describes exercises that workers can use to improve health and fitness. In California's Silicon Valley, the Rome Corporation has established a multi-million-dollar recreational facility, while Texas's Tenneco has a fitness center few can rival. All of these organizations report advantages to providing these benefits to their human resources. In addition to enhanced production, absenteeism is reduced, as are health care insurance costs. These examples are not, however, a recommendation to mortgage your organization to provide workout facilities or swimming pool. What is being implied, however, is that employers should work toward assisting employees with the control of stressors from outside the work activities themselves. One notable aspect of off-the-job issues to manage is that of nutrition, while another is substance abuse. We all know that education tends to increase production capability through enhancing the skills of the labor force and providing opportunities for advancement. An element of concern, though, is the institutionalization of ongoing education and training as opposed to doing it when convenient or required. Education must include, and in many ways surpass, on-the-job training. To meet the upcoming global challenges, education must also pervade all levels of human resources, not just those occupying the basic labor force positions. Noel Tishy and Marianne Devanna, in their book, The Transformational Leader, describe systems that managers can adopt to effect institutionalization of changes, including education. Certainly, a major sense of their research, as well as others, is that new organizational realities demand ongoing education for labor forces and their managers. As the pace of change continues and the expectations of our human resources are modified, including increased productivity, significant levels of what is generically referred to as stress will set in. The conditions of jobs and their demands will be vastly changed over the next few years. From U.S. experiences, the combined cost of stress, as expressed in health insurance claims, disability claims, and lost productivity, may be as high as $150 billion per year. The U.S. National Institute for Occupational Health and Safety has predicted the continuing need to manage the factors associated with stress outcomes as the decades move along. One factor which leads to stress in the workplace has to do with the organization of work. For many workers, they have little to say about how a job is structured or organized, and less to say about how to possibly change it if hazards exist. Involving human resources in such healthcare management activities reaps many benefits, not the least of which is managed or improved productivity. We often find that the worker closest to the process knows it best, and in many cases offers beneficial recommendations for job changes and improvements. A November 1995 article in the San Diego Union Tribune newspaper suggested business owners must listen up. Businesses can benefit from employee ideas if bosses take heed. Of course, the benefit of listening is an empowered workforce which recognizes its value. Involving employees in the change management is essential, and so are efforts to develop strategies which enhance employee morale. One mechanism which is used often is that of providing incentives. Many incentives are linked to attendance, while others target performance. Of course, safety performance is a great aspect of work for which to provide incentives. Such incentives have a dual purpose. First, they assist employees in controlling outcomes, such as reducing injuries and illnesses. However, a very close second is to provide employees a morale boost and to heighten their involvement in the improvement and cost control processes. Morale, or rather good morale, is positively linked to organizations which show little or no mental stress problems. Morale can be related to both individual and group dynamics. Incentives should be tailored so that one or the other is not neglected. An example exists in a San Diego bakery where employees are provided numbers for a bingo game. For each week with no work-related injuries, employees who reach bingo and qualify receive $100. If, as a group, a month is reached with no work injuries, the bingo pool is expanded to $200 per winner. In 1994, this bakery incurred nearly 75 injuries that required reporting to their insurance company. In 1995, they have cut that figure nearly in half and have gone 6 consecutive weeks without a reportable incident. Employees report that the incentive provided by the employer has been key to their performance. Price Pritchett and Ron